Are you looking for the best dental insurance? In this video, I'm going to talk to you about the 3 best dental insurances you can get. But the secret is the dental insurance actually doesn't matter a ton. It's what's in the dental insurance that matters the most. Dr. Nate here from Thrive Dental and Orthodontics, and I asked multiple staff members, especially those dealing with insurance, what they think the best 3 insurances are, and here they are. Number 1 and 2 were pretty comparable. Number 1 was MetLife, and number 2 was Delta Dental. These are really popular just because there's so many providers that are in network with these 2 insurance companies, and you can get really good insurance policies within those dental insurances. Now, the 3rd one was a toss-up between a lot of different insurances, but the consensus kind of sort of was United Healthcare Insurance. Now, at our office, by far the most dental insurance we see is Delta Dental and MetLife. And like I said before, it doesn't necessarily matter the insurance you're getting, it's what's in the insurance that's gonna make or break you. So let me walk you through some key terminology that you should be looking for, whether you're looking for insurance for yourself or for your whole family. First off, let's talk about the difference between HMO versus PPO. HMO insurance really only lets you see 1 or 2 providers, whereas PPO, you can pretty much go to most dental offices, so you can go to the dental office that you prefer the most. Now, in HMO, a lot of people will just call this a discount plan. So there's a couple benefits. Number 1, HMO policies are relatively affordable, which is nice, but the downfall is that if you need dental work, you don't really have much insurance coverage if you have an HMO insurance. So with PPO dental insurance, you're likely gonna have 100% coverage on preventative things, which is stuff like x-rays and maybe easy cleanings. And then if you need any dental work, some crowns, some fillings, some deep cleanings, typically you're gonna have roughly anywhere between a 50 to 100% coverage. Now you can tell that's a lot different than HMO. HMO, you're not gonna have those coverages. You get a discount plan that the dental office offers to you. So right off the bat, if you need a lot of dental work or even actually just a moderate amount of dental work, PPO is by far gonna be your best bet. Now, if you're just gonna get your regular dental cleanings and you really don't care about the office and how it looks, or the provider that you're gonna see, an HMO may be okay for you. So now you know the big difference between HMO, PPO, but let's go into some very specific terminology that you're gonna need to know before you choose your insurance. The first one that gets a lot of people is the waiting period. Now, waiting period is the amount of time you need to wait before your insurance even kicks in. So some insurances will have anywhere from a 3-month to a 12-month waiting period. So even if you got insurance today and you want to get your work today, you're gonna have to wait 12 months before you get anything done or anything that your insurance will at least cover. Now, of course, there's plenty of dental insurances that have no waiting period, and those are the best. Deductible is something that applies not to just dentistry, but applies to a bunch of things. Deductible just means the amount that you have to pay before your insurance kicks in. Now, to be honest, in dentistry, this is not a huge thing because most deductibles are pretty low. They're anywhere from like 50 to 75 bucks, but just something you should know before you get your dental insurance. Now, percent coverage is the amount that your insurance will cover after that deductible is hit. And this is huge if you're gonna have a lot of dental work that needs to be done. Some people get extremely great coverage and their insurance covers 80 to 90 to sometimes 100% of their fillings and crowns, whereas others cover as low as like 25, 35%. So you can see if you need a lot of dental work, the difference in coverage is gonna make a huge difference to you. Now, I'm not saying one is right or wrong, it just depends on what you specifically need for your dental health. Now, this one gets a lot of people, and it is something called the missing tooth clause. This is a big one, especially if you are missing teeth, because it prevents you from getting any dental benefits if that clause is in there. So what it basically is saying is if you had your tooth taken out or the tooth was out before you got your dental insurance, and now you get your dental insurance and you want to get a bridge, an implant, or something in that spot, if you have that clause in there, the insurance is going to cover 0% of that. That is why this missing tooth clause is such a big thing. If you have any teeth that are out, or maybe you're anticipating getting teeth out, it is such a huge clause to look for in your dental insurance. Lastly, we got my personal favorite, and that is orthodontic coverage. Typically, this is not in all dental plans, so you may have to add that in yourself. General dental benefits typically renew every year, whereas orthodontic benefits typically are a lifetime maximum. Most dental insurances offer anywhere from maybe $1,000 to $3,500 towards your orthodontic benefits that can be used towards braces or Invisalign. But that does not renew every year. So once you've used those benefits, they are done. And we also have yearly maximums. This is also big if you need a lot of dental work, because some of the yearly maximums can be as low as $500 or $750, but some of them can go all the way up to $4,000, $5,000, $6,000, $7,000. Yearly maximum just means the amount that your insurance is going to pay before it kicks off. So if you have a yearly maximum of $1,000, but you need $2,000 worth of dental work, it's going to stop paying any dental insurance benefits after that $1,000 or after that yearly maximum has been met. Now you're more knowledgeable than you were before, so you can make some great dental informed decisions for yourself to get the best dental insurance possible. You know the difference between HMO, PPO, you know deductibles, you know ortho coverage, you know waiting period, you know missing tooth clause, you know a bunch of other stuff that I went through, and I'm interested to know, what dental insurance do you have? Let me know in the comments below, because I'm interested to know what dental insurance do you have and if you like it or not. And if you're wondering what the difference is between a normal cleaning or a deep cleaning, you can check out this video below, and make sure to like and subscribe, and I'll see you guys in the next video.